Hi everyone, good evening. And today we'll be talking about head injuries during contact sports. Today I'll be joined with welcome to our channel. And now I'm just going to ask to join us. Hi, Dr. Subhash.
Hi, good evening.
Hi, good evening. Thank you so much for joining us, Subhash. Hi everyone. Can you all please do join us on Instagram Live? And today we'll be talking about something very common, very common, and it is today we'll be talking about injuries, head injuries during. I'd like to welcome you all on rampalsurgery.com, and today I have the opportunity to share our broadcast with Dr. Subhash Patil. He's a general surgeon who's heading the Taylor's University in Taylor's School of Medicine here in Kuala Lumpur. And he'll be talking to us a little bit more in detail about how to deal with head injuries or concussions during contact sports. So welcome, Dr. Subhash. So we'll just wait for about 5 to 10 minutes to let everyone come on, and then we'll probably start. Yeah.
Yeah, good
I'd
evening.
like to thank everyone for joining us.
Good
Yeah,
evening,
I'd
Dr.
like to thank everyone to Instagram Live. We tried to actually do it on Facebook Live, but we seem to have technical problems. It's much easier to do it on Instagram Live. So we thought, okay, we're just going to do it on Instagram then. Yeah, and we're thankful that Subhash was able to join us. Yeah, so we're going to start probably at 1:50 in 3 minutes time. We're just going to wait for everyone to come in. Dr. Subhash, thank you so much for joining us. Maybe you can introduce yourself within this 3 minutes so we can start off. Yeah.
All right. Okay, thank you, Dr. Sanjiv. Good afternoon, everyone. So I'm a general surgeon, and to start with, I was trained in India, and subsequently I've done my fellowship from Glasgow, UK, and I worked for Ministry of Health, Dubai, for around 7 years, and then followed by another 8 years, with International Medical University IMU here in Malaysia, and subsequently, I like moved to Singapore, and I was working as a consultant surgeon with special interest, breast cancer in Singapore, Changi General Hospital for another 4 years, and since about 5 years or so, I am now, with the Taylor's University School of Medicine in Kuala Lumpur, and I'm the head of surgery, and I'm also the vice chairperson for the medical education as well with the Taylors right now.
So as you can see, Dr. Patel has a long line of accolades after his name, and we are so proud to have him here today. And thank you for joining us, Dr. Patel. So today we're going to start our broadcast. So today we'll be talking about concussions or head injuries in contact sports, and overall in Malaysia and overseas, as the easing of restrictions goes on, we're going to go back to contact sports, and we see that it's quite rare to have the head injuries, but it is a dreadful situation where we have to deal with with head injuries, and this can be quite devastating to the patient's life, and also quite quite a big injury to parts of his health. So we sometimes we as general people are involved with contact sports, and if we are in a situation where we can save a life. So today I thought we have a session with Dr. Patel, since he's a distinguished member of our fraternity, and I thought we'll get him to explain to us how to actually deal with a patient who or a person who has hurt his head or is unconscious during contact sports. So overall, in Malaysia and overseas, the data shows that there is injuries of a concussion is actually quite rare in contact sports, and it's more common in sports like rugby, American football, and it is relatively rare to get it in on a football pitch. But as you know, if you watch the English Premier League, Peter Cech got injured with a head injury a couple of years ago. Raul Jimenez, who's a prominent striker for a local for a team in the English Premier League, he had a severe head injury, and we had a patient high morbidity for these players who are involved with these contact sports. So today we're going to get and it shows, the data shows that actually women are actually more prone to be involved with head injuries, and is especially in soccer. They're more common to be involved with head injuries in soccer. So today we have Dr. Subhash, and he'll be telling us how to actually deal with a patient who had a head injury during contact sport. So Dr. Subhash, would you like to explain it to our audience, like how would you deal with a patient who's unconscious or possible head injury?
Okay, so not making it too formal. So let me highlight two aspects related to head injuries. The first one is we can discuss these issues in context of general public and in context of healthcare workers, the support staff, and also in terms of the primary care or the emergency medicine doctors.
Yeah.
This first thing. Secondly, whenever we start discussing about head injuries, in various forums, so what we need to remember, we shouldn't be misled by the fact that the patient is brought unconscious, or the statement says that the patient is brought unconscious. So just because the patient is brought unconscious, it doesn't necessarily mean that the patient has head injury. So as we all know, so we need to know the basic trauma life support. So we need to follow the ABCDE, airway, breathing, circulation, and so on, because without any head injury also, patient can be brought unconscious if the patient has an airway block, or if the patient has bleeding and the patient is in hemorrhagic shock. So the patient may be brought unconscious without any head injury. So still the priority is ABCDE, airway, breathing, circulation, extremity, disability, and so on. Okay, so once that part is settled, like airway is secured and so on, so then we move on to the head injury part, because as you can as you would know, so the any salvageable head injury is not going to cause immediate mortality, unlike airway obstruction, which can kill a person within minutes, and hemorrhagic shock in an hour or so if it is very severe and all that. So that's why we still need to focus on the basic trauma life support, ABCD, and so on. Now moving on to the head injuries proper. So today we are discussing mostly head injuries related to sports activities. Okay, so athletes and people who indulge in contact sports and combat sports are more likely to end up with head injuries. Okay, understandably. Now whenever a player, let's say whatever game it is, rugby or football and so on. So whenever a player is suspected to have a concussion, so first thing is we need to remove that player from the game. So that's very important. So it is not wise to allow the player to continue playing, assuming that it could be some minor injury. So even if there is suspicion of concussion, so player has to be removed. That is very important to start with. And then certain warning signs like headache, especially with increasing in intensity, and history of loss of consciousness, even if it is for a minute or even few seconds also. because that indicates that there is significant injury to the brain once there is a history of loss of consciousness. Although at the time of examination, even if the patient is fully conscious, so history of loss of consciousness is an important sign. And then obviously then the other signs of increasing intracranial tension, like vomiting, and obviously more severe, like blurred vision and fits and so on. Okay, so and also associated neck pain, because once head injury, and if the patient especially is let's say unconscious or is in altered sensorium. So important, cervical spine injury and cervical cord injuries cannot be ruled out. So the patient complaining of neck pain, and these are some of the warning signs wherein you need to seek medical
Yeah. So basically, from what you said, Dr. Subhash, so basically things to look out for is severe headache, unconsciousness, and also blurring of vision, right? So, Dr. Subhash, what would you said this now that you should not you should stop play, right? Stop the actual injury from getting worse. So you should stop play, and also remove the player from the game, which is there. So I guess Dr. Subhash's connection has been a problem. So he got logged out. It's fine. We'll wait for him to log back in. But besides that, so things to look out for when a person is having a possible head injury is patient will be unconscious, they'll be having severe headache, and also they'll be having severe headache. He'll have also possible vomiting, right? And he's unable to join. Yeah, Dr. Subhash. So,
yeah, right.
yeah.
I think there's a network issue. Right.
So, we'll take some questions after this, but basically, this is basically a patient information session. So we will be addressing questions as a general, just for patient information, not specific advice. But anyway, as what Dr. Subhash said, Dr. Subhash said that just now he emphasized that the signs and symptoms would be, or signs would be having a headache, a loss of consciousness, also possible vomiting, and loss of concentration. These are all signs and symptoms of a patient of having head injury. So now, coming to, you said also, Dr. Subhash also mentioned that he should stop play, remove the patient from the situation. So that, I think that's a very important point that Dr. Subhash made. That means you should stop play. Life is important. So we address the problem at hand and then we move on. So now, Dr. Subhash, can you tell us how to prevent further damage? So should you like immobilize the patient, or when now let's say you are a colleague, I mean you are playing, your fellow playmate, and he falls down after maybe a header or a head injury. So what would you do? What would you advise the patients to do?
Yeah, okay. So the first one, obviously, he need to remove the player from the game, and then try to talk to the patient, try to make out whether the patient is conscious and whether well oriented, into time and space. And then if possible, then if you have the equipment, so then check for the blood pressure and pulse and so on. And also we also need to rule out other more serious injuries which are closer to the head injuries. So there is a cervical spine injuries, because if we don't protect the cervical spines while manipulating the patient, so possibly a stable cervical spine injury could become unstable, and it could cause, like a compression on the spinal cord, resulting, like a very severe neurological, problems like paralysis of the all the four limbs and so on. Okay, and then obviously, then you need to know, like you need to seek, like medical help as soon as possible. And if you don't have a medical team as such, and you need to take the patient to the nearest, available, like accident emergency, department.
Yeah, I think that's a very good point also. So to address the problem, get a healthcare worker to deal with the head injury. So don't try to deal with it yourself. And I think a CT scan would be the next order of scale. And do not try to address the problem without expert aid. Yeah. So a question here by one of our viewers, and he said, "Doctor, why is it that they say you should not sleep right after you have a concussion?" So, would you like to address that question?
All right. So anyway, there are umpteen examples of sportsmen, especially, like footballers, who sustained injuries during the game, became, unconscious for a few minutes, and then subsequently completely recovered and continued to play. And then, the next day they are found dead, in the apartment, assuming that they were living alone.
Yeah.
Okay, so this brings us to another aspect of, head injuries. So what is called as a primary brain injury and secondary brain injury. So meaning of primary brain injury is the injury sustained at the time of the incident or the accident. Okay, whereas secondary is the one which develops later. Now the importance here is primary injury. Obviously you can't do much about it because the patient already presents, with that injury. Secondary is the one which is either preventable or, or if identified early, it is, it is completely treatable. So coming back to this example, so patient, let's say, sustains a concussion, so unconscious for a few minutes, and then neurologically completely stable for the next few hours. And then now what happens is, let's say the concussion is a primary injury, and subsequently there is a blood clot, hematoma, which develops intracranially, which slowly spreads, and then it starts to exert pressure effects, and then the patient is going to develop, like severe headache and vomiting and blurring of vision and convulsions and so on. So if the patient, is not taken to the hospital immediately and so on, and CT done, and if there is any extradural, hematoma or the blood clot, even if it is evacuated, on time, so then the recovery is going to be very good. So this is what we call it as a primary injury and secondary injury. And this one is also, like in medical terminology, is described as lucid interval. So the lucid interval is a clear interval, clear in terms of the neurological function of the patient, are clear. So there is one attack of loss of consciousness because of the initial injury, complete recovery, that's a lucid period, lucid interval. Then once again, worsening neurological status because of spreading or expanding blood clot. So this is very important that, any patient who presents with history of loss of consciousness, even if it is doubtful, we need to observe these patients for, at least 48 hours in case they end up developing any spreading intracranial hematoma.
So as what Dr. Subhash said, the important thing is if you have an injury, a head injury, or you have a possible injury to the head or to the brain, so we should get healthcare workers to address it, and also go see a doctor, because even a short interval of unconsciousness can lead to, or can be a first sign of head injury, and we don't need to wait for that, and that needs to be addressed immediately. So there's another question about cricketer Phil Hughes was injured with a ball hitting his neck. Is that considered under head injury? So I don't really know Phil Hughes. Do you know, Dr.
Obviously, I mean.
Okay, so
Yeah.
maybe address that, but basically, if it's the neck, then it's a different injury, and if if he has injury. Uh,
Okay, I think here, like, yeah, I mean, with regards to Phil Hughes, I mean, the cricketer who died on the field. There are two things here. So, head injuries and neck injuries can occur together because, they are closely related in terms of, like anatomy. And secondly, even if there is neck injury, because head injuries can be because of direct impact or they can be because of indirect impact, as in vigorous movement of the head, even without any direct impact to the head, can lead to like brain injuries. Because the brain, like is enclosed in the cranial cavity, and the inner surface of these bones where the brain lies, there are quite rough and sharp edges, they have. So these many bones there. So that's why even if there is an indirect, vigorous movement of the head, let's say blow on the neck, of course, it can cause neck injury, cervical spine injury, but it can also cause, indirectly it can cause head injuries. So
okay.
there's definitely a possibility.
Thank you so much, Dr. Subhash, for your expert opinions and for patient information. I think we're going to end here. Thank you so much, everyone, for joining us on Rampal Surgery iOS, and we'll be seeing you next week and talking about further problems of the hip and knee with Dr. Suresan. Yep. Thank you so much. Bye bye, everyone.
Okay, everyone. Thank you, Dr. Sanjeev. Okay, bye.